Hello everyone. Welcome back to the course on Health Humanities, Indian and Western Medical Knowledge Traditions. This is lecture number 58 on Digital Health Humanities, which is a part of the future of healthcare. In this lecture, I will talk about what is Digital Health Humanities and then what are different types of digital and technological concerns which are used for healthcare systems. So to define digital health humanities, it is use of digital methods and computational tools to understand health science for scientific research. So digital health humanities is the use of digital methods and computational tools to understand health science for humanistic research. So digital humanities is only using digital methods and computational tools to understand humanistic research from different perspectives. According to Christian Auster, digital health humanities draws from a wide range of other fields, including critical code studies and media theory, computer programming, and biomedical informatics, science and technology studies, health policy, human-computer interaction, user experience design, and health promotion and behavioral science, as well as historical and ethical reasoning. In this way, digital health humanities is very broad. It is interdisciplinary in nature, and it borrows ideas from different sources, from digital to legal to technological to different other sources, historical, ethical as well. The US Food and Drug Administration observes that digital health includes mobile health, health information technology, wearable devices, telehealth, and telemedicine, and personalized medicine. So digital health humanities includes different types of technology like digital watches, which one is using to monitor one's health, telemedicines, telehealth, and many other forms of medical practices. Digital health humanities also includes the use of technologies and different kind of trends which have transformed the healthcare and has brought rapid technological advancement. Technology plays a vital role in advancing medicine, enhances diagnostic treatment options, and provides patients engagement through telemedicine, through AI, through wearable health trackers. So digital medical humanities or digital medicine tries to help the patients through different options, through different mediums, through wearable devices, through AI, through diagnostic treatments, and many other forms. It has led to digital health revolution, and this revolution can be seen in the form of telemedicine and virtual care. Mobile health. What is mobile health or M-health? That like one is having apps in his or her mobiles, and the heartbeat, the blood pressure, the oxygen level, everything is being constantly monitored. Or it is also about how the mobile cell phone system has become very significant in the system of healthcare, where one is getting one's turn, one's time, all the information through messages. And when a person is like also having some kind of disturbances, since one's health is being monitored, then he can immediately be advised through different apps. or through certain wearable devices. It can help in remote monitoring and chronic disease management. We further find that there are now social media also used for health concerns. For example, we find some people who give advices on WhatsApp, Facebook, and Twitter. They ask that their information will be kept secret. However, to what extent the person will keep the information secret or these companies will keep secret, that remains questionable. So, though we find that uh, health concerns have been now different hospitals have developed their own apps like ABHA apps or some other apps which are uh, used for curing, treating, and as well as uh, tracking the illness and disease. And these like digital revolutions have been used in personal as well as clinical settings. Sometimes they provide information in different languages, and hence these apps, those who are not knowing English, they can understand in their own mother tongue. However, the questions will be raised about their privacy and accuracy. To what extent they provide uh, correct information, and to how can they integrate social, cultural, historical, and other dimensions. Because health is not only about the physical body, the concerns of health are also about the social, cultural, historical, political, and other modes of existence. For example, artificial intelligence in machine plays a major role in the healthcare system. We find AI assisted diagnosis and imaging, and the role of AI, as I discussed in the previous lecture, are very debatable, and how they intrude the privacy or sometimes how they try to replace the human being itself. The roles of robotic surgeries or robotic communications are also becoming very prominent in the healthcare systems, where human beings are replaced by the robots in terms of communication and information. And also we have robotic surgeries where the precise surgeries will be conducted through the artificial intelligence. And so these like what to call digital medical practices are preventive and proactive in care. They focus on wellness and lifestyle. They try to actually have behavioral health integration, but the risk cannot be ignored because there is a risk of data hacking, there is a risk of confidentiality and privacy. Further, there is questions, ethical questions in terms of data ethics, data war, or bias in AI, because the AI can give biased information. And when we have too much reliance on digital technologies, digital medical practices, then data privacy can be challenged. Though it can help a person that they can get immediate access to medical care in the case of emergency. For example, a person who met an accident, and if his entire data is available, and once his basic information is put in computer, his rest of the data, what kind of medicine, what kind of other challenges the person is having, that can come up, and accordingly medicines can be used to treat him. But this can lead to further questions about privacy and confidentiality. So health data is very important because it can be misused. It can damage one's identity, one's selfhood, one's dignity. With digital medical practices, we find that it has given access to the global health. It has given equity, and sometimes it provides access to care in low resource settings. But it has been also facing certain problems. One can get access through like mobile clinics, that one can make a phone call to the doctors, tell the problems, and doctor can send the prescriptions, give the advice on the WhatsApp in written form. However, it can also raise some questions about income disparity and expensive healthcare facilities, because the digital health practices can have different kinds of demands and everyone may not be able to fulfill those demands. So to conclude, the future of technology has enabled the facilities of healthcare to most of the people, though it is patient-centered, but it has certain concerns. And it needs to emphasize the idea of integrating a health system with the common people, with the people who are on the margins, and it can, where it can help in preventing different types of illnesses and diseases. It can provide equity to everyone. It can be equitable to the patients. However, the questions of interdisciplinary research are very difficult. The questions of accessibility of data and its privacy is very difficult to maintain.